Welcome back to Rachel Collins, Real Sex Education. If your period has started changing, you're waking up in the night drenched in sweat, or you suddenly feel like a stranger in your own body, you are not alone, and you are not going crazy. By the end of this video, you'll understand what perimenopause and menopause actually are, why all these symptoms show up, and what you can realistically do, from lifestyle changes to medical options, to feel safer, more comfortable, and more in control. If you're new here, make sure you subscribe and hit like so you don't miss any of our future conversations. Let's start by clearing up two words that get mixed together all the time: perimenopause and menopause. Perimenopause is the transition phase. It's the time when your ovaries are starting to slow down, your hormone levels are fluctuating, and your body is moving toward the end of menstruation. This phase can last several years. During perimenopause, your period hasn't stopped yet, but it often becomes irregular. Shorter cycles, longer cycles, heavier or lighter bleeding. Menopause, on the other hand, is a specific point in time. In medical terms, you're considered to be in menopause when you've gone 12 months in a row with no period, and there is no other medical reason for that to happen. After that, we often say you're postmenopausal. So if you're still having some kind of bleeding, even if it feels random and confusing, you're most likely in perimenopause, not menopause yet. Does that already sound a bit like what you're going through? The unpredictable cycle, 1 month early, 1 month late, sometimes twice in 1 month? What's happening behind the scenes is that your ovaries are running out of eggs, and your estrogen and progesterone levels are changing. Sometimes the brain is sending strong signals to push the ovaries to ovulate. Sometimes the ovaries don't really respond. That hormonal up and down is what creates so many of the symptoms people associate with menopause. From those basic definitions, let's move into what you might actually notice first in your day-to-day life. For a lot of people, the very first sign is a change in the period. You might notice your cycle gets shorter. Instead of coming every 28 or 30 days, it might suddenly be 24 or 21 days, so you feel like you're getting your period all the time. Later, it might swing the other way and come less often, 40 days, 60 days, and then eventually stop. On top of that, your flow can change. Some people get much heavier bleeding with clots and need to change products more often. Others get super light spotting. All of this can feel scary, but irregular cycles are a very common part of perimenopause. It's still important, though, to talk to your doctor about any big change in bleeding, especially if it's very heavy or lasts a long time, just to rule out other conditions. Around the same time, many people start to experience the classic hot flashes. Hot flashes are sudden waves of heat that spread through your body, especially your chest, neck, and face. Your skin may turn red, your heart might beat faster, and then you might start sweating, sometimes a lot. Some people also feel chills right after. Have you ever been in a meeting or at dinner and suddenly felt like someone turned an invisible heater on inside your body? That's a hot flash. At night, similar episodes are called night sweats. They can wake you up, force you to change your clothes or sheets, and make deep sleep really hard. This is not you being dramatic. It's your body reacting to hormone changes that affect how your brain controls temperature. As these changes continue, you may also notice shifts in your weight and in how your body feels overall. Another big change that often shows up around menopause is weight gain, especially around the belly. Even if you're eating the same and moving the same way you always have, it can feel like your body suddenly stores fat in new places. This happens for a few reasons. Your metabolism usually slows down with age. Your muscle mass can decrease if you're not doing resistance training, and estrogen plays a role in how your body distributes fat. Many people gain around 3 to 5 kilograms, or roughly 6 to 10 pounds, during this transition, and that can feel frustrating and unfair. The loss of estrogen also affects your bones. Estrogen helps protect your bones from breaking down too quickly. When estrogen drops, bone loss speeds up, and the risk of osteoporosis, bones becoming thinner and more fragile, increases. That's why this is a key time to talk with your doctor about bone density tests, calcium, vitamin D, and appropriate exercise. Beyond that, some people notice more joint pain, muscle aches, or a general sense that their body hurts more than it used to. Again, this isn't you being weak. This is a known part of the hormonal shift. So the key thing here is this. Menopause isn't just about your period stopping. It touches your entire body, your brain, your bones, your heart, your metabolism, your skin, your sleep, and your sexual health. From the body, let's move into what happens emotionally, because this part is often ignored or minimized. During perimenopause and menopause, many people experience mood swings, feeling fine one moment and suddenly irritated, sad, or anxious the next. You might feel more sensitive to stress, quicker to cry, or like your patience has just evaporated. Some people also notice symptoms of depression or increased anxiety for the first time, or a worsening of conditions they had before. On top of that, sleep often gets worse. Night sweats can wake you up, but even without those, some people find it harder to fall asleep, stay asleep, or feel rested in the morning. Poor sleep then feeds into mood problems, and the cycle continues. Have you ever thought, I don't recognize myself anymore? I used to be so patient, and now everything sets me off. This is not a character flaw. Hormone changes can affect neurotransmitters in the brain, the chemicals that influence mood, focus, and energy. But there's also a psychological layer. Menopause can bring up feelings about aging, fertility, sexuality, and identity. Society often sends harmful messages about women losing value as they age, and that can absolutely impact how you feel about yourself during this transition. If you're noticing changes in mood or mental health, it's really important to reach out to a therapist, to a trusted healthcare provider, to friends who can support you. You do not have to tough it out alone. Now, since this channel is about real sex education, we also need to talk about how menopause can affect sexual health in a respectful, non-graphic way. As estrogen levels fall, the tissues in the vagina and vulva can become thinner, less elastic, and less naturally lubricated. This can lead to vaginal dryness, burning, or discomfort. During sex, that dryness can cause friction and pain, which may make you feel anxious or avoid intimacy altogether. This is an extremely common and valid symptom of menopause. It does not mean you're broken or that you've done something wrong, and it does not mean you have to give up on intimacy forever. In a minute, I'll share a situation I see all the time in my clients. But first, let's talk about what can actually help. There are several options you can discuss with your doctor. Over-the-counter lubricants for sexual activity, to reduce friction and make things more comfortable. Vaginal moisturizers used regularly to help keep the tissues more hydrated over time. In some cases, low-dose local estrogen treatments that target the vaginal area specifically, if they're medically appropriate for you. We won't go into techniques or step-by-step instructions here. That's not the goal of this channel. The main message is, pain is not something you have to just accept. There are safe, evidence-based options, and it's okay to ask for help. Here's the kind of situation I see all the time in my clients and community. Someone in their late 40s or early 50s notices their period is changing. They're exhausted, hot at night, gaining weight, and their vagina feels dry and sore. Sex starts to hurt, so they pull away from intimacy. Their partner maybe doesn't fully understand what's going on and starts to feel rejected. The person going through menopause feels guilty, ashamed, and alone. Does this sound familiar at all? If it does, I want you to know a few things. You are not too old for desire or pleasure. You are not obligated to push through pain to make anyone happy. You are allowed to slow down, to use support like lubrication or medical treatment, and to ask for gentleness and patience from a partner. Healthy communication might sound like, I care about our intimacy, but my body is changing and sex has been uncomfortable. I'd like to talk to my doctor and figure out ways we can stay close without me being in pain. This shifts the conversation away from blame and toward teamwork. Your comfort and your boundaries matter, always. From here, let's talk about what you can actually do in terms of treatment and daily choices. For some people with significant symptoms, hormone therapy can be an option. You might hear it called hormone replacement therapy or menopausal hormone therapy. This usually involves giving back some estrogen, sometimes combined with progesterone, to help reduce hot flashes, night sweats, vaginal dryness, and other symptoms. However, hormone therapy is not for everyone. Your doctor will look at your medical history, including things like blood clots, certain cancers, and cardiovascular risk before recommending it. It's very important not to start any hormonal product, even natural or over-the-counter products that claim to be for women's hormones, without proper medical guidance. Just because something is marketed as herbal or for women doesn't mean it's safe for you specifically. There are also non-hormonal medications that can help with hot flashes and mood symptoms in some people. Your doctor can explain which options might fit your health profile. Alongside medical options, lifestyle plays a huge role in how you feel through this transition. Movement. Regular physical activity, especially a combination of cardio and strength training, can improve mood, support bone health, and help with weight management. Nutrition. Focusing on balanced meals with enough protein, fiber, healthy fats, and plenty of fruits and vegetables supports energy and metabolism. Sleep hygiene. Creating a cool, dark sleep environment, limiting screens before bed, and having a consistent bedtime can help, even when night sweats are an issue. Stress management. Breathwork, mindfulness, therapy, or simply having supportive conversations with friends or a partner can lower stress, which often makes symptoms feel less overwhelming. If you're thinking, that sounds like a lot to change at once, you're right. The key thing here is, you don't have to do everything perfectly. Small, consistent changes are far more powerful than short bursts of perfection. As we talk about all these changes, it's also important to zoom out and look at the bigger picture of your long-term health. Menopause is not just a short-term phase. It's also a chance to check in on how you want to care for yourself in the years ahead. This is a good time to ask your doctor about bone density testing to check for osteoporosis risk. Keep up with cancer screenings that are recommended for your age group, like cervical screening, breast checks, and any uterine-related evaluations your provider suggests. Monitor blood pressure, cholesterol, and blood sugar, because heart health becomes even more important as you age. Think of this as your body moving into a new chapter. You deserve up-to-date information and proactive care in this chapter, just as much as in your younger years. So as we wrap up, let's bring everything together. Perimenopause and menopause are natural stages of life, but that doesn't mean you have to suffer in silence. Changes in your period, hot flashes, night sweats, weight shifts, bone changes, vaginal dryness, pain during sex, mood swings, sleep problems, all of these are common responses to changing hormones, not proof that you're weak or broken. You are allowed to ask questions. You are allowed to say, "I'm not okay and I'd like help." You are allowed to advocate for yourself with your healthcare providers and in your relationships. If this video helped you feel more informed or less alone, I'd really love to hear from you in the comments. Tell me, what's one symptom you wish people talked about more? Or, what's one thing you would want your younger self to know about this stage of life? Thank you so much for spending this time with me today. Please remember to subscribe, hit like, and share this video with someone who might be quietly struggling with menopause and doesn't know where to start. And if you'd like to go deeper, you can check out my other videos on sexual health, relationships, and real, respectful sex education for adults. Take gentle care of yourself. You deserve it.